It's something that most of us do without even thinking about it, but more and more people have a difficult time swallowing due to a condition called dysphagia.
That's right. Dr. Kevin Komar is a gastroenterologist over at the Borland-Groover Clinic. Thanks so much for being here.
Thank you for having me.
I'd never heard about this before, so tell us what it is and give us a little idea of the symptoms.
Yeah, dysphagia is actually very common. It's a symptoms or medical terminology we use when we describe a patient that has difficulty swallowing. It's also used for other symptoms with, people often will say that food gets stuck in their chest or in their sternum, or gagging or choking after they eat, or even just a recurrent cough or hoarseness. Often it's due to problems with the mouth or the esophagus, which is basically just the muscle, the tube, that muscle that pushes the food down into the stomach.
What is causing it? Is it something that we might be doing that unknowingly might be leading to this condition that we can stop today?
There is multiple causes of dysphagia. When evaluating a patient, we kind of break it down into two types of causes. One is neurological. Is it muscle coordination, nerves, or is there actually something obstructive blocking you, blocking the food from coming down? Neurological conditions that we typically see in patients are things like a previous stroke, multiple sclerosis, Parkinson's disease, just esophageal spasms. Obstructive causes, things that are actually blocking you, things that are scary like esophageal cancer, esophageal strictures, or just simple things like just heartburn and reflux.
Is there anything you can do to prevent it? I mean, I know there are some things you can do about heartburn and reflux, but some of those other things that you mentioned, I would think you can't do anything about.
Most neurological causes are pretty unpreventable, but the obstructive causes can actually be prevented and even treated. Often just early diagnosis and treatment can prevent conditions from getting worse, or prevent you from developing further problems like esophageal cancer or a stricture that may require surgery rather than just simple stretching.
Well, that was going to be my next question to you, is that what are some of the long-term effects before we get into then how can we treat this?
The long-term complications that we worry about are things like malnutrition, dehydration, weight loss, respiratory symptoms. The bigger thing we're mostly concerned about is, a late diagnosis or a misdiagnosis for something like esophageal cancer, or poorly controlled esophagitis that can lead to esophageal cancer. Those, an early diagnosis or treatment can often change the prognosis or the course of future treatments.
Well, on that point, when should someone go to see a doctor, or if they've seen their primary and they said, oh, it's nothing, or it's heartburn, or this, at what point, if it continues, should they say, all right, I've got to go to see you?
Anytime you're having difficulty swallowing, anytime you feel like food is getting stuck, you should see a doctor. There's no questions about that. Obvious, more serious symptoms that you don't want to avoid are things like weight loss, regurgitation, poorly controlled reflux, recurrent nausea or vomiting, chest pain, but dysphagia is a symptom that should never be ignored.
And so if someone were to come into your office, let's say this afternoon, and they have the symptoms and they need to get a diagnosis of this, what is the test like? What should they expect?
I mean, the most important test is an adequate physical exam and history taken by a physician. Many times just that alone can help with the diagnosis. Typical tests that I order after an adequate physical exam and history is just an x-ray, maybe of the chest or the esophagus. Sometimes we order an endoscope, which is just a fiber optic visualization of the esophagus too.
And so what kind of medications, what are the treatments that are available for this?
If the cause is neurological, then the treatment options focus more on muscle strengthening, learning different swallowing techniques. If it's actually obstructive, a lot of times we can stretch the esophagus. We can refer the patient.
What does that entail? Because the esophagus is down here, right? So how do you stretch that?
It's actually a very common, basic
Yoga.
technique.
Come on.
Yeah, very similar, very similar. We take a small endoscope, fiber optic camera, we put it down. We can find the area that's narrow, and we take a small balloon and just stretch it.
Are you asleep for this?
You are completely asleep.
Okay.
Okay, and we can move on with this one.
So fixated on that question.
Right,
Sorry.
Hold on, stretch what? So if people are watching now, they want to get more information, first step obviously would be to call you guys to come in and at least get a thorough evaluation of their situation, I would assume.
Definitely. You never want to ignore these symptoms. Early treatment, diagnosis is definitely the key.
Okay. All right. Well, thank you so much.
Good to see you once again. Thank you for being here. We appreciate you. And we'd like to thank the Borland-Groover Clinic for sponsoring this segment. And to learn more, you can do so by going to borlandgroover.com. The website is there on your screen. You can also call 904-398-7205.